And now, our featured presentation. I am happy to hand it over to Evan Smith of the Texas Tribune, who will introduce and visit with our featured guest, Dr. Peter Hotez.
I'm Evan Smith of the Texas Tribune. It is always an honor to be here on behalf of People's Community Clinic and to be here with all of you. And I'm especially pleased to be with Dr. Peter Hotez, the leading virologist in Texas, founding dean of the National School of Tropical Medicine at Baylor College of Medicine in Houston, and co-director of the Texas Children's Center for Vaccine Development. Throughout the pandemic, you've not been able to turn on the news, read an op-ed page, or doom scroll through social media without seeing Dr. Hotez's name or conjuring the image of him we've come to know. Tucked into his office, always in a bow tie, often in a lab coat, a mix of calmly reassuring and bracingly candid. He's our state's version of Dr. Anthony Fauci, ubiquitous, expert, and apolitical to the extent that anything about the coronavirus is apolitical. And with the understanding that being apolitical is not the same as not having a point of view. Dr. Hotez definitely has one. He's been a crusader for years, for instance, against the flat earthers who reject science and recoil at vaccines, a fight he always believed was his responsibility to wage, but never more than now. His most recent book, published in March, is titled Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science. Dr. Hotez, it's good to be with you this morning. Thank you.
Evan, it's always good to see you, even if it's virtually. I'm looking forward to seeing you in person again, not too distant future,
One day, Dr. Hotez, one day we'll be together, I assure you. So I'm thinking as we talk today of two headlines that crossed my phone. One was in the New York Times, David Lionhart's column, COVID-19 is in retreat. The other is an Austin American-Statesman note that said that Austin has technically passed the threshold, allowing the city to go back to stage 3 of 5 stages, an improvement in the public health emergency, but that city health officials are reluctant to actually pull the trigger on that. I wonder if you would reflect on those two notions. One is that the disease is in retreat, but the other is that we're a little bit hesitant about getting irrationally exuberant again and racing to normalize all of our lives. What do you think about that?
Well, Evan, we've seen now Mother Nature has told us what COVID-19 does. Yes, COVID-19 does go into retreat, but then it regroups and launches a new counteroffensive. And I think we have to, Mother Nature's not been coy about what she has in store for us with COVID-19. Look what happened last summer when we had that horrible wave across Texas, and we were talking all the time, and that devastation, especially among Hispanic communities, and parents in their 40s and 50s and 60s losing their lives, and then it came back again this summer. It not only in Texas, but across the southern United States around the same time. Yeah. And now it's going down around the same time. But all we have to do is look what happened last fall when after Halloween, starting in November, it really revved up, and that was our worst wave yet. So that devastating one that also affected Texas in the winter. Yeah. So that's what I'm worried about, that we're once again becoming complacent. We think this is over. We're already hearing this on some of the Sunday morning talk shows that this is it. We're finally going to be out of it. We just have to get a few more people vaccinated. And I don't think that's the case. I think there's too many unvaccinated people. We've only vaccinated about 56% of the country that's been fully immunized. Right. And now the goalposts are going to move again on what it means to be fully immunized, because we're going to need 3 doses of each of the mRNA vaccines. We'll soon hear 2 doses of the J&J vaccine. Right. So there's a lot of warm water for that hurricane to pass over across the country. And we're already seeing this pop up now across the northern border with Canada. Wisconsin, Minnesota, North Dakota is looking really bad right now. Starting to get bad.
Dr. Hotez, you mentioned 56% fully vaccinated, at least as of the standard that we measure that by now around the country. Texas is behind that, right? Texas is basically at about 51% fully vaccinated. I mean, I'm old enough to remember when Governor Abbott went on Fox News a few months ago. It's actually more than a few months ago, and said we're approaching herd immunity. The reality is, Dr. Hotez, we're not there. We're not near herd immunity, and we're probably never going to get to herd immunity at this rate, right?
Well, I don't even like using the term herd immunity anymore because it's been so highly politicized, especially from the far right, using it as an excuse to prematurely relax our guard against COVID-19. And we have to remember how to look at this. Texas is a big state, and it's not homogeneous. And when you actually look at vaccination rates, what you're seeing is we're substantially higher than 51% in our urban areas and along the border with Mexico. We're doing a little better vaccinating. But Evan, you go to some of these rural counties in Central Texas and East Texas, forget it. Nobody's vaccinated or very low. So there's nothing to impede the Delta virus from continuing to cause a lot of devastation. And when you look at what's happened here in Texas, I can't say enough of how awful this has been. I see this as the worst single tragedy that's ever happened to the state of Texas, and I back that up by saying we're already at 66,000 deaths in the state of Texas, and
about 1 out of every 455 Texans has died during the last 19 months.
It gets worse because if you look at some of the Institute for Health Metrics evaluation projections, we're going to get towards 80,000 deaths by the end of the year. And I think, unfortunately, we are going to hit this. And the other piece of this, of course, is the most recent 10,000 deaths were completely unnecessary. Those 10,000 deaths occurred despite the widespread availability of safe and effective vaccines.
Right.
That is it's probably one of the most demoralizing things I've ever had to deal with in my 40 years as a MD, PhD physician scientist, is seeing those 10,000 people's lives needlessly snuffed out when they could have easily been saved.
Well, you mentioned that there's a disparity depending upon where you live. Geography is destiny as far as how this disease has progressed over the course of the last 19 months in Texas. You can't say that access was the issue in many of these places where the vaccine rates are low, right? It was a conscious decision on the part of the people who did not get vaccinated. And, they took the responsibility themselves for making that decision, but also we can't let leadership off the hook in those communities and at the state level. It does matter what the people in charge say, right?
Well, I even look at it a little bit differently than from that. I see those 10,000 lives that have been lost, unvaccinated lives lost most recently, as victims. They were victims of targeted, I don't even call it misinformation anymore, Evan. I don't call it disinformation. I call it what it is. This is anti-science aggression. Yep. These are groups that have deliberately targeted people across the state of Texas and nationally by more or less saying, to belong to our club, to belong to our tribe, to show allegiance to our right-wing extremism, it means not being vaccinated. That's not the only thing. There's a whole canon of ridiculousness from ivermectin and everything else, but among them is not being vaccinated, all under this fake banner, this phony banner of health freedom, medical freedom, which is the most self-defeating concept that I could possibly imagine. And it's a killer. Anti-science right now is one of the leading killers in the state of Texas and nationally.
But of course, the people who choose, Dr. Hotez, not to get vaccinated will say this is a personal decision. It only impacts me. You don't agree with that?
No, absolutely not. Well, first of all, not only does it impact you, it impacts your loved ones, your family members, the people you work with, but it also has created this horrific surge on our hospital system so that individuals who have other medical conditions are not getting the care that they need. It's a huge economic expense as well. So the idea that health freedom only affects you is ridiculous. Right. And what it does is it interferes with the freedom of others, because now you have parents who live in terror because of these individuals that their kids are going to get sick in schools, or they're going to get sick, especially if they're pregnant. And the vaccines are not perfect. They're good, but they're not perfect, and we do see this. So this is, and some people can't get vaccinated, like the little kids. So this is devastating.
Are you surprised, Dr. Hotez, at the existence of these breakthrough cases that we've seen over the last several months, where people were fully vaccinated and yet still contracted the virus? I mean, to me, as I think back over the last year, the thing that's most surprising is we were presented with the vaccine as an answer. And there is no perfect answer to anything, but we were told, get vaccinated, this is actually going to be, the way forward for us. And in fact, it turns out that many people who were fully vaccinated and went into their futures with confidence, it didn't ultimately work out the way they thought, or any of us thought.
Well, I think there was a problem with messaging these vaccines early on. When I saw that the first 2 doses, for instance, of the Pfizer vaccine were given 3 weeks apart, I understand why we had to do that. We had to do that to fully immunize the healthcare providers and the nursing home residents and workers to keep them safe. But when you created that 3-week interval, that's not what you would do to create long-lasting, durable protection. So I've said since the beginning that the Pfizer-BioNTech vaccine is going to be a 3-dose vaccine, and the J&J vaccine is going to be a 2-dose vaccine. From my standpoint, this was predicted and predictable that we would need a third immunization, just like we do all of our pediatric vaccines. We give a series of immunizations to our infants and young kids, and then we wait 6 months to a year, and then we boost, and that's how vaccines work.
So you are for the idea of a third shot. You're for the idea that any of us who's been fully vaccinated, we got to get a booster, whatever the timetable is. That's going to be necessary for all of us going forward.
I think so. And in fact, I don't even call it a booster. I always say this is a 3-dose vaccine. This is your third immunization. Right. Absolutely. Right. And what that will do is it's going to really jack up your virus neutralizing antibodies to protect you against infection. It's also going to give you longer lasting protection. So I don't necessarily think we're going to need a booster every year. And I think it'll give you more resilience against all of the different variants as well. So it's going to do a lot of things for you.
As you say, a lot of different variants, I begin to shudder because I worry that we'll get through the Delta and then there'll be something behind the Delta and then something behind that. It makes me wonder whether this thing will ever actually come to an end, or it's going to be more like the half-life of plutonium, gradually moving toward the horizon line but never getting there.
It's not a bad metaphor, but it could be like that. But on the other hand, when you look at places that have aggressively immunized to you, where you get over 90% of the population vaccinated, like they've done in Portugal, like we're approaching in some of the New England states. I think we can stop it. But the problem is the bar is high, and it's, when you've got a virus like the Delta variant that's got a reproductive number of between 6 and 8, what that means is you have to get to 85-90% of the population vaccinated to buffer you against incursions of the virus and new transmission. And that's probably going to mean, and fully immunized, that goalpost is moved to 3 immunizations. So you could say 85-90% of the whole population, not just the adult population, the whole population, vaccinated with 3 shots. You're going to say, well, we can never do that. Well, and the answer is, of course we can. We've done it for decades in Texas, for measles, for polio, and
isn't that the point, Dr. Hotez? There is a frame of reference here for vaccinating people against disease. We're acting as if somehow a vaccine mandate or a requirement that people get vaccinated for COVID is some new thing. When rubella, mumps, polio, meningitis, a lot of the very same people who have been complaining about mandating vaccines themselves submitted to a vaccine mandate when they sent their kids to public school, or when they themselves went to college. So somehow we're in a different place right now, but we have a history of making it so that people need to go along.
Well, yes, but also, Evan, unfortunately, Texas has been the tip of the spear of trying to erode childhood vaccinations as well. We have a very aggressive anti-vaccine lobby here that started pre-pandemic. It really revved up around 2015. We have our own political action committee, our own anti-vaccine PAC that's trying to interfere with childhood vaccination programs and basically say that, it's your choice whether or not you want to vaccinate your kids for school. And that's also created a lot of vulnerabilities. We have over 70,000 kids, according to the Immunization Partnership, that could be missing some of their vaccinations.
So this
and
is
that doesn't
fertile
count for
ground
any
in
of
a
the
moment like
300,000 homeschooled kids. So we've
it's
got
fertile ground in a moment like this for a conversation around vaccine mandates, right?
absolutely. And
Clearly.
if we're serious about keeping our kids safe, and we're going to need a COVID-19 vaccine mandate as well. And if you are committed to in-person classrooms and in-person classes, which I think most of us are, I certainly am. I'm the parent of 4 adult kids. When my kids were little, I wanted them, of course, to be in school. It's doable, but you've got to put the policies in place to make that happen. And that means mask mandates and vaccine mandates. And if we keep on resorting to phony medical freedom, health freedom arguments, we're just not going to be able to keep our kids safe.
Do you think ahead, Dr. Hotez, of the possibility of another pandemic and what we may have learned from this, and whether we are, as a state or as a country, prepared for the next time based on what we've been through now?
I would say we've not we've learned a lot of lessons of what's not working, but we haven't fixed very much. So, and that's both at the federal level, state level, and local level. I mean, at the federal level, our Centers for Disease Control and Prevention came up small so many times. We still haven't fixed that. And now the White House science advisor, Eric Landers, proposed we create he calls it a pandemic mission control in Washington, D.C., in which I say, well, that sounds good, but here's why it's not a good idea. Well, first of all, we saw in 2020 why you don't want to lead pandemic responses out of Washington, D.C. That's number one. Number two, and what they're really saying is we don't trust the CDC. We're going to create a mini-me CDC based in Washington. I'm saying, no, the answer is we got to fix the CDC.
Fix the CDC.
We're paying $15 billion in taxpayer money. And if it's not doing what we need it to do, let's do that and maybe refocus it only around pandemic threats, maybe some of the other things we don't need the CDC for. Let's figure out why they missed the virus entry from Southern Europe into New York, why they didn't protect the southern half of the United States in 2020 from the pandemic, why they never got diagnostic testing underway, why they never got genomic sequencing underway, why we still rely on Israel and the UK for all of our vaccine effectiveness data, why there's no predictive models. Just coming up small at so many turns. This needs a fix. And if we can do that, then we can lead pandemic response operations out of Atlanta, which was why it was set up. And I think that's where we have to put the focus.
So in the last couple of minutes we have, Dr. Hotez, I want to ask you about the public health ecosystem. Did public health step up adequately to address the worst aspects of this?
Yeah, and I saw this with Zika as well. And the same problems that we had with Zika were the same problems we have with COVID-19.
Yeah.
And that is we had, it was very much, a lot of it was done at the local level, and the quality varied quite a bit. So here in Harris County, where we actually have 2 public health departments, we have the City of Houston Health Department and we have Harris County. That's a pretty well-worked, those are well-oiled organizations and adequate, nothing is ever adequately supported, but it's better supported than some. But then you go to other counties across the state and they have almost no infrastructure in place at all. And you saw this massive, and of course in Houston, we have our Texas Medical Center, which has a lot of heft in terms of beds and staff. But you saw, especially in South Texas, how quickly those community hospitals got overwhelmed, or up in the Panhandle, how quickly those community hospitals got overwhelmed. A lot of the public health departments didn't have the tools or the staff or the backing in order to do what they needed to do. And that's why we hit 66,000 deaths. Evan, I think, if this trend continues, we're about to eclipse California as the worst state in terms of deaths from COVID-19. And that's just a horrible legacy. So I think, to honor those lost and that catastrophic loss of life, we really need to have to take a hard look at what's not working and try to do as best we can to fix it.
Okay. Dr. Hotez, it's been good to be with you. I mean, I can't say that I am walking away more optimistic about the world or uplifted, but what we look to you for is honesty. And in a moment where people are living in a state of denial rather than in the state of Texas, I appreciate you giving us a level set. So thanks so much.
Thanks so much, Evan.
All right.
What a great conversation. Thank you, Evan and Dr. Hotez, for the insight you provided us today and for sharing your time with us.